Now I will request Dr. Poornima Devkumar from University of Trans-Disciplinary Health Science and Technology to deliver her talk. Thank you.
Good afternoon, everyone. With my respects to all the dignitaries and all the students, audience gathered here, I'll start my today's session, Nurturing Longevity, Ayurveda for Healthy and Graceful Aging. Actually, Bhushan Patwardhan sir has already given us the guidelines of the gist from Ayurveda. I would like to see that I don't bore you with the same thing. I'll also share some of our research findings. So please excuse us, there is a difference in the configuration of slide here and what you are seeing there. Okay, so today's content is aging in Ayurveda and contemporary science, along with classification of aging and some of the tips from Ayurveda and relevant research studies from our university, TDU, and IAIM hospital. Aging is time related deterioration of the physiological functions necessary for survival and fertility. This is as per the biology definition of aging. So, what is the definition of aging in Ayurveda? It is that act of wearing out, that is jiryanti iti jara, that which has become old by the act of wearing out. Okay, so if you see the common points between biological definition and Ayurveda, it is the degeneration, depletion, and deterioration. Okay, so we all agree that aging is a process which involves degeneration. Types and factors that influences aging, there is two types, mainly broadly two types. Kalaja Jara, which is can be correlated with the chronological aging, and Akalaja Jara, which can be correlated with the premature aging, that which is influenced by the factors, various factors. It can be correlated with the biological aging of tissues and cells. So this is influenced by various factors, and the prime factors amongst them is these three: Ahara, Apatya Ahara, okay, Apatya Achara, and Apatya Vichara. Okay, unhygienic or unhealthy dietary habits, unhealthy lifestyles, and unhealthy thoughts. The thoughts, stress, anxiety, jealous, okay, what we call as Arishad Varga, they trigger premature aging. So we should be taking care of these, and even Prakriti, as Bhavna Prashar madam told, Prakriti also plays that we can correlate to some extent with the genetics, that also plays an important role in triggering aging. Okay, so now when we are talking about aging, let us understand the stages of aging mentioned in Ayurveda. Okay, so this is not different from what we know now, but what I would like to highlight is the effect of doshas here. There is Balya, the childhood, which is up to 16 years. It is mainly Kapha predominant. Madhyama, up to 16 to 70 years. It is known as Madhyama, which is Pitta predominant. And Vriddha, of 71 years onwards, and in Kali Yuga, it is said that we live for 100 years. Optimum aging is up to 100 years. From 71 year onwards, we call it as Ruddha. So that is Vata predominant. Okay, so this is as per the chronological aging. So we see that we should live up to 100 years, right? So what are, so now we know that stages of health aging, we should understand when we are talking about healthy aging, we should understand what is health. Already Bhushan sir and Bhavna Prashar madam, they mentioned about what is aging. We know that what is the definition of aging health in from World Health Organization. Ayurveda has given a comprehensive definition. Health is a state of harmonious balance of physiological functions, body tissues, digestion, metabolism, and excretion, along with the contented state of senses, mind, and consciousness. Okay, Samadosha, Samadhatu, Samagni, Malakriya, Prasanna, Atma, Indriya, Manaha, Swastha iti Abhidiyate. This is from Acharya Sushruta 5000 years back. And the foundational principle of Ayurveda is Swastasya Swastha Rakshanam. When we talk about longevity, preserving health, so this is the foundational principle, objective of Ayurveda, preserving the health of the healthy and to treat, to cure the disease. Okay, but how do we attain this? Okay, now we know that we should be healthy. So there are various factors that are mentioned in Ayurveda. I'll be dealing with the four main factors, main contributors, that is dinacharya, ritucharya, panchakarma, and rasayana. Okay, so this is the clock, Ayurvedic clock. Okay, what we understand is there is a dosha. The dosha will be having its influence as the day proceeds. There will be vata, pitta, kapha, influence will be there. Dinacharya is nothing but we are setting, we are connecting with our internal clock, right? So when vata is predominant, we'll be more active. Kapha is okay, so we should be thinking of more creative work. And when we say about breakfast, lunch, dinner, we should be having our good meal, heavy meal during the pitta kala in the diurnal time. Day clock and night clock is mentioned. And if I can say that the expression of language was different, but Ayurveda people knew about this circadian rhythm and also the secretion of melatonin, but the language is different. There are various research studies, especially in the chronobiological studies, where now we establish that circadian rhythm, the sleep cycle, is so important for healthy living. Okay, so this we need to follow as per the clock. Next, coming to seasonal regimen, it is nothing but connecting with the rhythm of seasons. India, we are bestowed with 6 seasons, and each season will have its different influence on the nature and also on the body. Okay, so we are Prakriti Purusha, what we call, no? So we are influenced by the changes of Prakriti. And accordingly, we should follow various diet and lifestyle transition as per the season. Okay, we cannot be consuming the same sweet taste in all the season. Okay, we cannot be doing similar kind of exercise on all the seasons without understanding the season's effect on us, without understanding our capacity during the season. And accordingly, there will be accumulation of the doshas, what we call vata, pitta, kapha, and there will be aggravation of the doshas, especially in Varsha, Sharad, and Vasanta Rutu. And there are mentioning of prophylactic measure of purification during this Rutu for healthy living. Prakriti, I will not get into the detail as Bhavna madam has told, but I would like to inform that why we should know Prakriti. Okay, for those non-Ayurveda people, if you are here, so if we understand our Prakriti, it is like, Kundali to our health. Okay, this is what is good for us. This diet and lifestyle may aggravate our doshas, so we should avoid or minimize these diet and lifestyle, and accordingly we should take these purificatory measures for a healthy living. So this is what Prakriti, knowing Prakriti and following Prakriti guidelines will help us to follow the path of health. Next, coming to Panchakarma. Panchakarma are a set of 5 purificatory, purificatory therapies, and they are designed to eliminate the toxins from the nearest way. For example, if for kapha and fat related condition, there will be medically induced emesis that is done, it is known as vamana. For pitta conditions, mainly for pitta conditions, medically induced supervised purgation, that is virechana. And for urdhva jatragata, for above the clavicle conditions, we recommend nasya, and even that has its influence on CNS also. And Basti Chikitsa is mainly given for all the Vata Vyadhis, and Rakta Mokshana is related with the Pitta and Rakta Dushita, okay, blood vitiated conditions. Okay, so one thing I would like to say is the procedure is same. The medicine what is used here will be different for each of these procedures based on the condition, based on the prakriti of a person, and for which they are coming to the they are coming to the doctor. There are various research studies that are established the positive impact of Panchakarma not only on the clinical conditions but also on biological and also cellular and metabolic profile is also established with the Panchakarma. Next, coming to Rasayana. Rasayanam cha tagneyam yat Jara vyadi nashanam. This will be the most interesting topic for today. Our next speaker, Dr. Suhas, will be he will be discussing more on this Rasayana. What I would like to inform here is Rasayana, it's just not the herb. It can be a diet, it can be a formulation, it can be even Achara Rasayana, the way we talk to other person, the way we maintain the code of conduct, even that is known as Rasayana, which cleanses our channels. Okay, the Rasayana mainly acts on the three stages. One is Rasa, that is direct nutrition. One is at the level of Agni, that is digestion and metabolism. And one is at the level of Srotas, microcirculation and bioavailability, clearing the channels. It can act through all these levels. And through this, there will be improved quality of tissues, which in turn improves the longevity, immunity, and mental power. Dirgamayu Smriti Meda. So it has a wide impact. Rasayana has a wide impact on our health, which helps in improving the longevity and healthy aging. So there are various herbs. Amla is now considered as a superfood because of its multimodal action to improve the nutrition, to clear the channels, and there are studies which have shown improved absorption of iron when compared to the control, threefold improvement in iron absorption in cell models. So there are studies done at our university. Both amla and pomegranate have shown the improved absorption. Next, coming to research and case studies. Actually, at our university, Trans-Disciplinary University, we have clinicians and scientists. We work together on the concept and practice of Ayurveda, where we study the experimental and preclinical studies, mode of action studies based on the concept and practice of Ayurveda. We design clinical studies based on the same in the form of whole system studies, in the form of observational real world data. I'll be sharing few of the study results with you which may interest you. And as we know, the aging is predominantly ruled by Vata dosha. So there will be more of a degenerative conditions during aging. So one such condition is Parkinson's. So this was a case of Parkinson's, a PD case who was 62 years old, and he was suffering from PD since 3 years. And you can observe that. Okay, so this is the when he came to us first time, baseline. Okay, he's not able to get up. There are tremors. Okay, with the 21 days of treatment, you can see the person walking. Okay, you can see the person walking without rigidity and tremors. Even on the scale of UPDRS, we could see improvement, significant improvement. There are many such cases that can be treated in Ayurveda. So we have observed nearly 1600 plus PD cases, and what we and our team of doctors are trained with Parkinson's and Aging Research Foundations, Bangalore. And what we generally observe is reduction, Ayurveda integration can help in reduction of tremors and rigidity, improvement in the gait, sleep, bowel movement, speech, and we can help in tapering the allopathic medications that might be causing some side effects. So this is what we observe, and this is observed in even any other Ayurveda hospital. I'm not telling that only we are doing this. In any other Ayurvedic hospital, this result will be observed. And inspired by the clinical observation, our team of Ayurveda biology, we have passionate scientists in our team who actually tested these herbs which are given in Parkinson's disease and Vata Vyadhi. So there they have tested Brahmi, Ashwagandha, Kapikachu, Jyotishmati, Bala, Mandukaparni on neurodegeneration model of C. elegans, and you can see that all these herbs, especially Brahmi and Kapikachu, it has helped in reduction or neuroprotective measure is observed. Okay, there is a reduction in neurodegeneration. This is the model with neurodegeneration. And inspired by the effect of Brahmi Grita was taken. It was tested on wild type worms. You can observe that there is a improvement in the longevity. Okay, so Brahmi Grita showed significant extension in longevity in wild type worms. So when we are talking about healthy aging and longevity, so this is an important observation which improves the confidence of clinicians. Okay, so I'll be sharing few more data now. And Brahmi Grita has improved cognition. Brahmi Grita and Brahmi extract has improved cognition when it is tested on healthy adults and elderly. This is a wonderful study which has incorporated internationally validated scale, fMRI. Even our team is here, blood parameters, Agni and Prakriti. So, and then what they found is Brahmi Gita has improved, especially in older adults. It has given highly significant result in learning and memory parameters. You can observe here, Brahmi Grita has given in auditory learning, in logical learning, visual learning, um, logical memory, visual memory. So, in all that, Brahmi Grita has given highly significant result in older adults. In younger adults, it has given highly significant result in auditory learning and also in related parameters like sleep, quality of life, digit span. So there it has given highly significant result. And one more interesting point to notice here is when we are talking about grita or ghee based, there will be a concern in the clinicians, like concern even in the public, whether it will have its impact on the lipid parameters. Like I am having already hypercholesteremia, can I take this ghee? So that will be the question we'll be facing as physician. But surprisingly, what is found is presence of ghee or Brahmi ghee. It did not affect the lipid profile adversely. You see the result that after taking of Brahmi ghee, in fact, the lipid profile LDL and triglyceride total cholesterol is reduced, and there is a improvement in HDL. So this is one study which is one revelation that presence of herbs, okay, which mainly act on the agni or nourishment, they may not be increasing lipid profile adversely. Okay, so one more model was on Huntington disease. Here, one more rasayana is used. What we use as Ayurveda physician, Ksheerabala Taila 101 is the most common medicine what we give in Vatavyadi, right? So it is taken and it is given to the worms with the Huntington disease worm model. There also, significant improvement in the lifespan is noticed. And thrashing assay. Thrashing assay is the movement of worms which can be correlated with the nervous system and motor system, where with the presence of Ksheerabala 101, there is an improvement from the day one in HD, Huntington disease worms. Okay, you can observe the significant improvement in thrashing assay, that movement in the worms. So which actually establishes the concept what we are using in clinic, so that evidence we see in this preclinical study. So last 3 slides. One study we did during COVID season, just to know, understand how exactly some of the activities mentioned in Dinacharya that will have its effect in people. Okay, so during COVID, what we did near Bididi area, we selected 5 villages. They are healthy adults, but that season, that period was COVID period. And we did a study by implementing that, creating awareness about their health and introducing Nasya and Taila Gandusha and also powder, Kshamatva Churna, which mainly contains Guduchi. So that was done, and nearly 300 participants were given this measure. And what we observed was there is a significant improvement in Swasthya score. If you see here, we have a tool that is developed by TDU IIM on measuring swasthya, that is wellness. You can come to us just to know, just to get the assessment of swasthya. And there we saw that 68% of the people, after following these, there is an improvement in swasthya. And also we see that there is an improvement, 69% of the people, they showed physical domain improvement as per WHO quality of life, and 78% showed psychological improvement, and 84% people with the respiratory illness, they showed that there is improvement after we gave this intervention. So we had created this ecosystem where what I want to say is, it is just not telling to the people. If we work on implementing this, we can achieve, create better awareness and also get better results by implementation of Ayurveda. Okay. So this is a case. Why I am showing this here is, aging comes with its own challenges, especially metabolic disease, wound management. So diabetic wound is a chronic condition. This patient, he had a chronic diabetic wound, and he came to us with the prescription of amputation. Okay, so he just came for a second opinion, and he was treated with Ayurveda and integrative management, and after 3 months he could walk on his own without amputation. So this kind of wound management is really good in Ayurveda. Ayurveda can contribute significantly for wound management. And this is a case of mucormycosis, and this patient was brought to us, just, I should not say this, but the family has suggested, like, he had tried all the systems, and then for a peaceful death, they had brought this patient to our hospital, but he was treated on the line of Shwasa, and then you can see, because of the configuration of PPT, it is not that clear, but the lung picture before and after, it is clear. This study is published, you can read this study. And so what I want to say is, Ayurveda can treat various conditions, even with the aging, swasthasya swasthya rakshanam, and also on aturasya vikara prashanam, disease, management to the sick, where we can integrate Ayurveda for better outcome. Ayurveda has a strong scientific basis for its concepts and algorithms. More research studies are required to explore its mechanism in the contemporary language for the benefit of the society. Let us embrace positive knowledge from all the streams for a better society and healthy aging. Thank you. I conclude my session here.